hemangioma. How common are they, if you can explain, please?
Tumors in the hand, they're relatively common. They're the most common benign tumor of the hand. So they do happen frequently, but they're not cancerous. They can be treated fairly easily.
And doctor, as a follow-up, there are other types of cysts or tumors that can develop in the hand. Can you expand on that for me?
Oh, sure. There are multiple kinds of tumors that can develop in the hand. Again, only about 5% of tumors that happen in the hand are cancerous. The rest of them, 95%, are not. But some of them, common names are like lipoma, which is a fatty tumor. You can get something that has a scary name, but that is not scary. It's called a giant cell tumor. You get cysts in the hand, very commonly associated with arthritis. You can have cysts that develop around the fingers. Some of the tumors that develop in the hand are related to skin conditions like basal cell tumors or squamous cell tumors. There are cysts that can develop inside the bone. Uh, some of them are made out of cartilage, some of them made out of bone.
Can I add to the hemangioma discussion?
Of course, Dr. Wallet, please do.
Well, with hemangiomas, 50% of babies are born with a hemangioma someplace because you're in growth mode. But the majority of those involute and go away. Those are those little strawberry hemangiomas you see on babies' backs, etc. And there'll be occasionally some that are left in the hand, but the majority of those go away. Now, there's some that start to go haywire. They never are malignant, but they're aggressive. They steal blood supply. And so some of those tumors can make it difficult. So even though it's a benign tumor, if it starts to grow, you do want to get it checked out, and you do want to get a study in such a way that you can tell, do you have more? Because they're skip lesions to these hemangiomas. They go in kind of a nerve distribution. And so you'll get one in your finger, one up in your arm, and another back up at your shoulder. Most of those you don't have to deal with. It's usually just the one in your hand that's causing the steal, but you can get them in the forearm as well. And so just be aware, very rare when you get into that, but there are a number of people that will deal with that, from hand surgeons to the interventional radiologists.